live. And we are set.
Okay. Good evening and welcome. My name is Jimmy Palmieri and I'm the chair of the West Hollywood Human Services Commission. I'd like to begin with the land acknowledgement. The West Hollywood Human Services Commission acknowledges that the land on which we gather and that is currently known as the city of West Hollywood is the occupied, unceded, seized territory of the Gabrielino, Tongva, and Gabrielino Kij peoples. In an effort to protect public health and prevent the spread of COVID-19 coronavirus, AB 361 has authorized public meetings to take place via teleconference because state and local officials are recommending measures to promote social service distancing. Please note that the Zoom platform is the official viewing platform for this meeting to afford the public with an additional viewing option, and in order to expand access to our meetings, this meeting is also live streamed as a courtesy on YouTube at youtube.com/WehoTV. However, because YouTube is a third party and operates independently from the city of West Hollywood, the streaming reliability cannot be guaranteed. I'd like to call this meeting to order. It is the West Hollywood Human Services Commission meeting for 7/19, and it is now 6:04 p.m. Leslie, would you like to lead us in the pledge?
I'd be happy to.
Oh.
Thank you.
Okay.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Leslie.
Pleasure.
Dee, can I get a roll call, please?
Absolutely, Chair.
Thank you.
Commissioner Borelli,
Present.
Commissioner Byers,
Here.
Commissioner Darvish,
Here.
Commissioner Davis,
Here.
Commissioner Freiberg,
Here.
Vice Chair Meltzer, I'm so sorry,
Here.
and Chair Palmieri.
Here, thank you.
We have a quorum.
Approval of the agenda. Can I get a motion to approve the agenda?
So moved.
Second.
Motion by Borelli. Who was that second?
Vice Chair.
Second by Meltzer. Can we get a roll call?
Absolutely. Commissioner Borelli,
Aye.
Commissioner Byers,
Aye.
Commissioner Darvish,
Aye.
Commissioner Davis,
Aye.
Commissioner Freiberg,
Aye.
Vice Chair Meltzer. You're on mute.
Aye.
And Chair Palmieri.
Here, thank you. Yes. We are at public comment. I would just like to remind everyone that this is for general public comment. If you are speaking on the public hearing, that would be item 3A. That would be item 3A. This is 1D for general public comment. And just to let everyone know, we do have a Spanish interpreter available. D, do we have anyone for 1D?
No, I do not have any public commenters for item 1D. However, if anyone in the room would like to speak under general comment, again, not speaking on item 3A, but just under general comment for the commission, please feel free to raise your hand at this time.
Is this general comment?
Yes, this is.
Is this general comment for services? I don't understand.
Yes, this is for general comment. This is 1D. Did you want to speak?
I would speak for, I'm a participant at Jewish Family Services.
So that will be for 3A.
3A?
Yes.
Oh, good. I wasn't given that.
Okay, thank you
number.
very much.
Thank you.
Anybody else, Dee?
Excuse the interruption.
Thank you.
No, it's okay. Thank you. I see someone staff meeting. I apologize. It just says staff meeting. Did you have public comment? I see your hand is raised.
Yes, we do. I have two clients that would like to speak.
So I just want to remind the public speakers that this is for general public comment. This has nothing to do with 3A.
Well, they would like to say a public comment.
Okay.
Okay.
Great.
You want to talk? They told me that you guys will have translators this time.
Yes.
Yes.
Okay. Tina, puedes hablar en
Yes.
español si quieres.
But let's clarify that if it's for staff recommendations, that's during the public hearing.
Oh, okay. Sorry about that.
Thank you.
Thank you so much.
Anything else,
Thank you,
Steve?
David. No, let me lower this hand. No, that is it, Chair.
Okay. Consent calendar, there are no items. Unfinished business, the public hearing, social service staff's funding recommendations for 2023 social service contracts. The Human Services Commission will receive social service staff's recommendations for social service contracts for the October 1st, 2022 to September 30th, 2023 funding period. We'll hold a public hearing to receive public comment on the recommendations. I'm going to hand this over to David right now.
Good evening, Chair Palmieri and commissioners. I'm David Juni. I'm the manager of the city's Social Services Division. I'm joined by Leslie Eisenberg, Social Services Supervisor, by Derek Murray, Joan Mithers, and Katie Egan, Social Services Program Administrators, and by Dee Saunders, Social Services Specialist. As you just mentioned, Chair, the Commission will receive recommendations from staff for social services contracts. This is for the 2022-23 funding period. Even though we look at a 3-year cycle, we make the recommendations for 1 year at a time. Folks that we contract with, then we go back. There's the availability of 2 1-year contract amendments. But we're just looking at the first year tonight. Following the staff's presentation, as you mentioned, there will be a public hearing, which is for the community to provide input on these recommendations. So as you recall, the deadline to respond to the social services RFP was Friday, June 3rd. The city received 37 applications. Of those, there were 6 for new programming and included applications from organizations that the city has not contracted with previously. So the City Council approved the budget for fiscal year 2023, and in that budget, they approved $6,378,852 in general funds. This represents the largest increase to social services contracts since cityhood. In addition to the $6,378,852, the city makes available $44,607 this coming year in community development block grants. Basically, it's a pass-through. We get a larger allocation. This is the part that's dedicated to social services, specifically for homeless services. This has traditionally gone to the organization that we contract with for shelter bed nights for adults. Recently, these funds have gone towards our contract with Essentia. So you've got those 2 funding sources. Now, with that said, the 37 applications represent $8,537,029 in requests. So approximately 2.2 million more than what's been made available in the approved budget. So I just want to share a little bit of what goes into what guides staff's recommendations for these contracts, because it's a very difficult job, and we do want to be consistent and really take as many things into consideration as possible. So some of our guidance is, of course, we make these recommendations based on service priorities and what we call priority populations. You were involved in the engagement process that led to the development of the actual RFP document. And many of the folks on the call, tonight were also involved in that process. So we do an extensive engagement process. Staff goes to all of the boards, the city's boards. We go to 3 of the city's commissions. We went to the Social Justice Task Force, to the Homelessness Subcommittee, the Council's Homelessness Subcommittee, get their input, bring it to the commission, review it with you, incorporate it into the RFP document, and get your approval, any input that you have, take that to council, get their input, and approve it. So number one in our mind is with these the applications is making sure that we are addressing the priorities both with service and with populations. So in addition, with formulating our recommendations, we do our best to look at this from an unbiased point of view, frame of reference. There's no favorites. There's no, we look at this, we look at an application, we try to look at it with a clean slate, and we keep that in mind when we're working to make these, when we formulate the recommendations. We do also look at, I think this is very important, we look at a service, say like substance abuse treatment. We know, and the folks on this call know, that substance abuse and mental health, those are issues that are priority issues, but also sometimes the most difficult for anyone to consider reaching out for assistance and help. So we want to make those services available in as many forms, as many modalities, the variety, whatever you want to say. We want as much as possible available to the community. With substance abuse treatment, we have been fortunate to have the availability of inpatient medical detox. We've had residential treatment, and we've had various levels of residential treatment. We've had transitional treatment or transitional sober living. We've had different types of sober living available. We've had outpatient treatment services available. We look at the services that way because we want to present as many opportunities for the community members to access service. Maybe I've got to face that, that issue I have, my addiction issue, but I have to keep working. I can't stop working. Maybe I can consider that outpatient service. So we look at it that way because you'll look at these recommendations. We have mental health recommended with many different organizations, but we want that. We want it to focus on different populations. We want there to be different types of counseling or individual therapy, group therapy. So we keep that in mind also when we make the recommendations. And then we do, of course, look at, with our currently contracted agencies, we do look at a history of service provision. If there have been challenges to service provision, if there have been significant difficulties in meeting the requirements of a contract with the city. These are general funds. These are basically your tax dollars at work. We take it very seriously. We are not going to make recommendations when we don't have the confidence that the services will be able to be delivered. So that's some of the guidance that we keep in mind when we're formulating these recommendations. We are pleased with what we saw, what we received in these applications. You're going to see in here that we do what staff is recommending. There is an increased availability of mental health services. There's an increased availability of legal services. There are availability of services to support victims of sexual assault, domestic violence, intimate partner violence. There's also a recommendation for a program that would provide sexual assault prevention. We have additional food, nutrition, and wellness services. We have the opportunity to increase the availability of food and nutrition to unhoused community members. And finally, we have the availability to expand our street-based outreach, focusing on our unhoused community members. We did see, which there's been a big call for, we did see proposals that expanded the hours that they can make staff available to do outreach, to do it late nights on weekdays, to do it on weekends, to provide outreach on weekends. And we got a proposal to provide an additional multidisciplinary street team, a street team that can provide crisis response 7 days a week for 12 hours a day. So we're pleased with what we're able to bring to you this evening. I'm going to turn it over to Leslie, Leslie and the program administrators will each go through in detail, a little more detail, their recommendations. It'll come back to me and I'll finish this portion with our recommendations with regard to the new programs. So with that, I'll turn it over to Leslie.
There we go. Thank you, David. Good evening, everybody. Good evening, Chair Palmieri, Vice Chair Meltzer, and Human Services Commissioners. I'm Leslie Eisenberg, and I'm the Social Services Supervisor. I'm going to briefly review the funding recommendations for the agencies I monitor. In alphabetical order, we first have Jewish Family Services, Saban Community Food and Resource Program. SOVA requested $148,132 and staff is recommending the full amount. The program supports people in need due to poverty or low incomes, as well as people experiencing homelessness in the city. In addition to providing free groceries at the Pico Robertson Pantry and the Kings Road site for residents of the LACTA buildings located in West Hollywood, Jewish Family Services proposes expanding the SOVA program to include a weekly pop-up pantry for unhoused community members. The additional funds requested cover the expanded services and increases in food costs. Next is JBS Socal's Weho Works program. Staff is recommending $158,692, which is their current grant amount plus a 2% cost of living increase. The program supports people in need due to poverty or low incomes by providing job placement and training. The program also offers business services that include recruitment events and job fairs. The Weho Works program is located in the West Hollywood Library and receives rent and parking in kind from the city of West Hollywood. Next is the National Council of Jewish Women. NCJW requested $142,046 and staff is recommending the full amount. The rental assistance program administered by NCJW supports people in need due to poverty or low incomes and addresses the needs of people at imminent risk of homelessness. NCJW's proposal reimagines their standard rental assistance program, which first came into existence during the economic downturn in 2009. The agency proposes changing the rental assistance program from a one-time urgent need model to an expanded service that supports more community members over a longer period of time. The additional request reflects an increase in rental assistance funds to provide 4 months of assistance, giving people more time to recover from financial distress. Next is Pathways, the organization that operates the West Hollywood Preschool located in Plummer Park. Pathways requested $148,603 and staff is recommending the full amount. The West Hollywood Preschool supports children, youth, and families, as well as people in need due to poverty or low incomes. By providing a free or substantially subsidized full-day, year-round preschool for income qualifying families, the West Hollywood Preschool offers parents and guardians the opportunity to provide for their families. The additional request covers increases in personnel costs to help hire and retain staff. Next is Planned Parenthood Los Angeles. Staff is recommending $89,446, which is their current grant amount, plus a 2% cost of living increase. Planned Parenthood supports women and people in need due to poverty or low incomes. The agency provides sexual health services and STD prevention and treatment, and their work supports the HIV Zero initiative. Planned Parenthood is a vital, one-of-a-kind service located in West Hollywood. The agency provides a comprehensive range of high-quality reproductive and sexual health care services, including birth control, testing and treatment for STDs, HIV testing and counseling, PEP and PrEP, and safe abortions. Last is Saban Community Clinic. Staff recommends $207,702, which is their current grant amount, plus a 2% cost of living increase. Saban Community Clinic supports children, youth, and families, people in need due to poverty or low incomes, low wage and immigrant workers, and people experiencing homelessness in the city. Services provided include sexual health services and STD prevention and treatment, and these services also support the HIV Zero initiative. Saban Community Clinic is a unique provider offering a wide range of medical services, and they are the only provider to offer dental services. And now I'm going to turn it over to Derek Murray. Thank you.
Good evening, everybody. Derek Murray, Social Services Program Administrator, and I'm going to go over the staff recommendations for the agencies that I monitor. So starting out with the Alliance for Housing and Healing, as you know, they provide rental assistance, pharmacy assistance, and housing case management for people living with HIV, and they also provide rental assistance to older adults in the city. And staff is recommending the amount which was requested, $198,939, to adequately cover personnel expenses that meet the city's living wage ordinance. Next is APLA Health. So APLA Health provides non-medical case management, behavioral health, benefits counseling, and the HIV Elders program. Staff is recommending $263,375, and we are recommending their current amount plus a 2% COLA. We're not recommending the continuation of the homeless support services, as the expansion of the homeless outreach teams and the addition of a street medicine team will replace this service with more of a direct and enhanced service for unhoused people living with HIV. The elimination of the homeless support services will allow for a greater increase in wages for the non-medical case management, benefits counseling, behavioral health, and Hive staff. Next is Being Alive. Being Alive offers various wellness activities for people living with HIV in addition to mental health services, and they also operate the weekly syringe services program. So staff is recommending $137,719, which includes $1,000 in urgent funds. So this is so we're recommending a $14,740 increase in funding. As you know, Being Alive provides the weekly syringe services program to prevent HIV transmission through injection drug use. Additional funding will expand the scope of the service to include overdose prevention services. The funding will expand the program to include Narcan, naloxone distribution to community members who are at risk of overdose. Increased outreach will engage and encourage housed recreational drug users to utilize their Saturday pop-up for Narcan, fentanyl testing strips, HIV and STD testing, and linkage to substance use and treatment services. Next is BATSETIC, which provides legal services for the community. Our recommendation is $150,856, which is their current grant amount plus the 2% cost of living increase. The LGBT Center's mental health services, our recommendation is $220,584, which is the full amount requested. And we are proposing that this increase in funding will include the Stop Violence program and also to cover additional personnel costs. Staff's not recommending the continuation of the mental health outreach and referrals for unhoused persons, that service category. Because the expansion of the street outreach teams and the addition of a street medicine team will provide this service. So the program will dedicate 100% of a mental health clinician to the program to shorten the wait times for individual therapy. The Stop Violence program will provide individual and group counseling, prevention, advocacy, and housing assistance for any West Hollywood community member who is a survivor of violence. The Stop Violence program at the LGBT Center will continue to have LGBTQ+ specific group support programming, but intimate partner violence and sexual violence services can be utilized by any member of the community, regardless of sexual orientation or gender identity. The next program is the LGBT Center Sexual Health Program. The staff recommendation is the current funding plus the 2% COLA, which comes to $246,075. Next is the LGBT Center's WeHo Life program. Staff recommends an increase in funding to $135,213 to expand the program to include sexual violence prevention materials and information. This is, as you know, this is the date rape drug test kit proposal, which was one of the new proposals, and we are incorporating this into the WeHo Life program. WeHo Life currently provides condom distribution, so they would also include sexual violence prevention materials in addition to sexual health. So this harm reduction program will distribute GHB and ketamine testing strips to prevent drug-assisted violence in West Hollywood bars and nightclubs. So in addition to condom distribution, the expanded WeHo Life project will include targeted social media posts and distribution of collateral materials to increase community awareness about HIV and STD prevention, PrEP and PEP, and substance use recovery services. Next is Men's Health Foundation. We are recommending the current funding plus COLA, which is $86,857. Next, we have TransCan Work. Staff is not recommending TransCan Work. TransCan Work has faced significant challenges through the last 3-year contract cycle, and they have not demonstrated the ability to consistently meet agreed upon goals of this contract. So staff is not recommending a renewal. Next, we have the Trans-Latino Coalition. Staff's recommendation is a significant increase, $120,869 increase, and the total would be $198,565. And this expands the program to include 2 full-time staff who will work primarily with unhoused transgender and non-binary community members, asylum seekers, and those engaging in survival sex work. Services include a drop-in center, legal aid, food and nutrition services, emergency financial assistance, clothing, peer support, and linkage to shelter and other types of transitional housing. Also in collaboration with the Los Angeles Hospitality and Training Academy, the HTA, Trans-Latina will expand its range of services to include workforce development and skills building workshops. And that concludes my presentation. Next is Joan Mithers.
Good evening, commissioners and everyone attending. I'm Joan Mithers, Social Services Program Administrator. So in the interest of time, I won't mention this for each of the programs that I monitor, but all of them address priority populations, services, and city initiatives. They include street outreach, substance treatment, people living with disabilities, older adults and aging in place, HIV prevention and HIV zero, and the expansion of food and nutrition services. Also going in alphabetical order, Awakening Recovery staff is recommending that Awakening Recovery have access to the $25,000 treatment pool of funds. Funding is paid out based on actual bed nights of service provided. Treatment is much needed, and the funds will only be spent when people utilize services. For the Disabilities Community Resource Center, staff is recommending $62,710, which is the current funding plus a cost of living adjustment. DCRC serves a small number of community members living with disabilities, and this funding will allow the agency to focus on its areas of strength: home secure services, and case management. The Friends HIV Education through Street Outreach. This program provides street-based outreach services and HIV prevention. Currently, it provides case management services as well. The agency proposed providing case management as a separate standalone program. Staff's recommendation is to continue case management services under the existing outreach education program. So staff's recommendation of $196,665 is larger than what the agency requested, but incorporates funds for increased case management staff time and services and an increase in urgent funds, putting it into this program rather than funding a separate standalone program. Friends Outpatient Substance Abuse Treatment. As with the Friends HIV Education Program, currently case management services are a component of this program. The agency proposed separating out the case management into the standalone program. Staff's recommendation is to continue case management services through this program. The recommended funding of $161,749 includes funding for additional case management staff and services. Next is Jewish Family Service Comprehensive Service Center. This contract serves a very large number of older adults and people living with disabilities and provides a broad range of services. Staff's funding recommendation is for $1,061,191, which includes the cost of living adjustment and also some additional funds to cover the increase in cost for home care services. The funding recommendation does not include additional agency management staff. However, also of note is that this agency also receives space at the Plummer Park Community Center to provide the services. Project Angel Food is next. Staff recommends increasing funding to $182,266 to address the increased need for this high priority service. Proposed service goals are significantly increased from current goals. Additionally, the fund that was requested and is being recommended is less than half of the actual cost of providing the meals. Seeds of Hope. Staff recommends increasing funding to $75,888. The Seeds of Hope proposal increased the number of locations for produce distribution, therapeutic gardening, and nutrition education and cooking. The proposed, the recommendation increases the funding level to support this increased level of service. For Tarzana Treatment Centers, Substance Use Disorder and Patient Navigation, staff is recommending $93,467, which is the current funding plus a cost of living increase. The recommendation is based on continuing with one full-time outreach position. And that's my portion. I will turn it over to Katie.
Thanks, Joan. So I'm going to be speaking to the contracts that are related to homeless services, as well as food and nutrition and aging in place. So again, in alphabetical order, we will start with Essentia. So Essentia's proposal was to continue providing unhoused community members with outreach, interim housing, case management, housing navigation, and housing retention services. Staff are recommending that they receive a grant of $380,153, combined with a community development block grant of $44,607. So with both of those amounts combined, that is the full amount that was requested from Essentia. This additional funding includes an amount to be able to fund 2 full-time outreach staff that will allow Essentia to expand homeless outreach services to include early mornings, late nights, and Saturdays. Next, we'll move to Housing Works. Housing Works proposes to continue providing housing retention and case management services to formerly unhoused community members, the majority of whom are older adults. Staff are recommending a funding amount of $143,233. And this amount is an increase that will allow Housing Works to increase their personnel to address increased personnel costs, as well as allow for a $2,400 allotment for urgent funds. Staff are not currently recommending additional funding for Housing Works to hire a life skills advocate position or for additional food support, as these additional services can be accessed through other contracted and regional partners. Next, we have JFS Nutrition. JFS Nutrition is proposing to provide free nutritious meals, and that can help to reduce food insecurity, promote health and well-being, and increase socialization among older adults and adults living with disabilities in West Hollywood. Staff are recommending a funding amount of $612,908. And this is a pretty significant increase to their current funding amount. And it is meant to address the agency's increased personnel costs in order to meet the city's living wage ordinance, and to cover a partial increase in the increased food costs and vehicle costs that the agency is facing. Next, we have the LGBT Center, the Senior Services Program. The Senior Services Program provides a wide range of services to older adult community members, including case management, food services, housing navigation, mental health support, social activities, and educational programming. Staff are recommending a funding amount of $100,032 in order to cover urgent fund needs, as well as additional food, nutrition, and wellness services. The increase also includes a 2% COLA for personnel and facilities costs. Also at the LGBT Center, we are next going to youth services. The youth program supports unhoused young adults through outreach services, interim housing, case management, housing navigation, as well as educational and vocational training. Staff are recommending funding amount of $173,834. And this is to not only provide the 2% COLA, but also to expand the vocational program to include training in hospitality, social services, new media, and healthcare. And lastly, Step Up on Second proposes to continue providing outreach, case management, housing resources, and street-based behavioral health services to unhoused community members. Just as a reminder, Step Up specializes in working with our unhoused community members who are chronically homeless and who may have mental health conditions or substance use disorders. Staff are recommending a funding increase to $393,083. And this is to address increased personnel and vehicle costs. At this time, we are not recommending an increase to add an additional outreach staff person, as staff believe that those outreach needs can be met through other recommendations around increased outreach through other contracted partners. And now I believe I'm going to turn it back over to David.
Thank you, Katie. So then I'll finish up with the staff's recommendations for the new applicants, new programming, and also go in alphabetical order, starting with Healthcare in Action. Healthcare in Action proposes to provide the City of West Hollywood with a medical crisis response team to respond urgently to the needs of unhoused community members. To achieve this goal, Healthcare in Action proposes adding a street medicine medical crisis response program offering urgent medical, mental health, and substance use care for unhoused West Hollywood community members. Staff does recommend this program slightly reduced from what the proposal requests. We are proposing to provide $522,476, which is 50% of this, what we consider to be a pilot program's total expenses. Well, and also a note with this, the recommendation brings us over the approved budget allocation, the city's approved budget. So we are recommending with this contract for supplemental funding. If commission agrees with this, we will go and request when we take these contracts to council for an additional allocation of unallocated general fund reserves. Following that is the Hollywood Food Coalition, which proposes to rescue high quality food that would otherwise go to landfills and to redistribute it at no cost to social service nonprofits serving food insecure members of the West Hollywood community. So with this program, what is referred to as generators, so those are grocery stores, restaurants, and hotels, they currently do have options. Our understanding is they do have options regarding organizations to assist them in their food rescue efforts, the Hollywood Food Coalition being one of them. Social Services does plan to continue building a collaborative partnership with the Hollywood Food Coalition. We definitely believe in this program, believe in the concept behind this program, but at this time, we do not recommend a contract with the Food Coalition. Following that is the Los Angeles LGBT Center's Date Rape Drug Kit. Derek explained that we are proposing that program, which really is sexual assault prevention, be incorporated into the WeHo Life program. From there, we go to the Los Angeles LGBT Center's Legal Services. The Center's Legal Services program proposes to provide trauma-informed and LGBTQIA+ specific safety planning, case management, and legal representation for survivors of violence, including domestic violence, sexual assault, stalking, hate crimes, and government/police abuse. The Legal Services program also proposes additional support service for the transgender community. Staff does recommend funding this program, this program, including support services proposed to provide the trauma-informed case management, the safety planning, the legal representation for the survivors of violence. We are looking at a reduced funding recommendation. We are not recommending the additional legal services for the transgender, non-binary, and intersex people as they have it stated. Those folks will be eligible and welcome to access the services proposed by this program, but we're not looking at bringing on or supporting the additional staff that would be specifically for those additional services. So it's slightly reduced. Our recommendation is for $98,818. Finally, the Maple Counseling Center proposes to provide no cost, low fee, culturally relevant, racial equity-based mental health treatment services to individuals and families through in-person and HIPAA compliant telehealth platforms. Staff recommends full funding of this program. That completes our presentation of the recommendations. I turn it back over to Chair Palmieri.
Thank you very much, staff. I appreciate all of it. Dee, I would like to have you address the public before I open the hearing as to the allotted time and how it will work.
Okay, thank you, Chair. So everyone who is here who would like to speak under this item being staff recommendations for this RFP funding process, you will have 2 minutes to speak. I will call on everyone in order first that I received in advance prior to the meeting, and then at the close of those who registered in advance, for lack of a better word, really, I will then ask everyone to turn your mics on, raise your hands, but you will have a total of 2 minutes. Thank you very much.
Thank you, Dee. So I will be opening the hearing, the public hearing for social service staff's funding recommendations for 22 to 2023 social service contracts.
Thank you, Chair. And so I am going to start. Crescencia Owen. Crescencia, if you are currently here in the meeting, if you can please take yourself off of mute, you will have 2 minutes. If you give me 1 moment, I'm so sorry, I'm jumping ahead of myself. Let me get the timer going for us. My apologies. I should have prepared this. Okay. And let me get you in here. Okay, Crescencia, are you in? No? Okay. The next public commenter that I have is Jesse Kalinowski. Jesse, if you are in, if I can please have you unmute, and if you are comfortable, you can turn your camera on as well. Jesse, are you here? Okay, I will go to the next. Sherry Bonanno. And my apologies if I'm mispronouncing your name, from the Hollywood Food Coalition. If you are in, please.
I'm here.
Okay. Okay, perfect.
You did a great job with my name.
Thank you. Okay, I am going to start the timer and you will have 2 minutes for your public comment.
Great, thank you. So this is the first time we've applied to for this grant, although we did start out as a social service organization and a food providing organization called the Greater West Hollywood Food Coalition. We started out because 35 years ago, the city council did the same thing they're doing now. They're asking for help from the community. And we started a program that has functioned 7 nights a week without fail for 35 years, providing prepared meals for anyone in the community who is hungry, who doesn't have access to having prepared meals. Our newest program we've started is our community exchange program. And that also started out in a request to help from, but this time not from individuals, but from nonprofits who are having trouble servicing their individuals. So at the start of COVID, many nonprofits asked us for help, and we responded to that call also by rescuing all sorts of food, including prepared food, which no other organization generally rescues and distributes it, so people can, in nonprofits, can serve the populations that they're building relationships with. We know from doing this every night for 35 years that having high quality food that a nonprofit can provide brings people in to receive services. And we have this feedback from many of the organizations we serve now. We, in 2 years, have built the community exchange to serve over 125 nonprofits in Los Angeles, throughout Los Angeles, so that they can provide better services to their people. And we serve the burden. I think one of the issues that was raised that we are putting the burden on the nonprofits to distribute food. We're actually assuming the burden of food recovery for the nonprofits. We're getting food from all over the city and the county, and then we cull it, we transport it, we store it, we go through it, we compost the stuff that's bad, and we give them only what they want and what they need in the amounts that they need, so that they can build the food programs they want, whether it's a prepared meal at their facility, whether it's an outreach for their outreach workers. Am I done? Is that too
Yes,
minutes?
I'm so sorry. That is your 2 minutes.
Very much.
Hello, excuse me, speaker.
You'll be called on when it's your turn, please. And if you could mute yourself.
Well, they passed. I was on mute and they just unmuted me and I was passed away. Well, I was passed by.
Okay, what is your name? Did I call your name already for public comment?
Yes, you called my name. It's Crescencia.
Okay, thank you so much. So Crescencia, you will have 2 minutes to speak under this item, and you can begin when you're ready.
Excuse the interruption. I'm calling on behalf of Jewish Family Services. I'm an ancient, and I want to know. I want them to be able to be acknowledged for the wonderful work that they do for all of us in this category. I'm a resident of West Hollywood and have received help, especially during C-19, regarding testing and getting more information and getting informed. Also, in transportation for procedures that, because I'm alone, I have no one. And also very much appreciate mental health assistance, and that is ongoing for the last 3 years. Also in food distribution and household care when I'm not able to do it myself, and give support to many activities that they've been able to have now and before C-19. And thank you for listening.
Thank you.
Thank you very much.
Thank you for having me. Good luck,
Okay.
everyone.
Thank you. Okay, I will go back to the first ones. Jesse Kalinowski, if you are in the room, if you would like to take yourself off of mute and address. Okay. Then with that, we have Brian Paquette from also Hollywood Food Coalition. Brian, if you are in the room, please feel free to take yourself off of mute, turn your camera on if you would like.
Hi, I'm here.
Okay,
I'm Brian Paquette.
perfect.
I'm the director of the Community Exchange Program. Just piggybacking on what Sherry said in her comment, I think it's important to understand that we have a different model with the Community Exchange. It's very much a concierge service that tailors the needs to the nonprofits that we serve. And as she was mentioning towards the end, like we definitely reduce the burden of the nonprofits receiving the food because we increase the quality and the quantity and make it really easy for them to receive food. We give all types of food, anything that they would need. We help programs get off the ground and sustain their services. And we find that the recipients that work in our program, that collaborate with us, end up growing their programs and have more people seek out their services because of the increased quality of their food program. As Sherry mentioned, it's a proven model. We work with over 125 nonprofits. We've been doing it for 2 years, but we need help expanding it. We did outreach in the West Hollywood community to see if there was a need. As Sherry mentioned, this program started because there was a need. Nonprofits needed a program like this, especially small to medium-sized ones that had trouble accessing food. And so we found that there was a need in the community in West Hollywood to serve the target populations. And that's why we applied for this grant so that we could expand our program to take in more food. That allows us to facilitate food to the West Hollywood organizations that are serving people in need there. We get food from all over Southern California, all types of food. And we're able to facilitate, if we're able to get more in and grow our program, we can facilitate more to those nonprofit organizations. So that's what I wanted to share. Thank you for the time. Appreciate it.
Thank you.
Thank you, Brian. Next is, too many pages, excuse me. Okay, next up we have Asher Lando. Asher, if you are here.
Oh, sorry, I'm here.
Okay, perfect. Let me start the timer. When you begin, you'll have 2 minutes.
Okay. Well, thank you, commissioners, for giving us a chance to speak on behalf of Hollywood Food Coalition tonight. Ultimately, the goal of our proposal, as Sherry and Brian mentioned, was to take the concierge model we have developed over the past few years into West Hollywood and start new hyperlocal food programs that reach communities that are currently left out of the food distribution system. We did this by collaborating with nonprofits that have strong social ties with a specific food insecure community, but can't rescue food on their own. We are able to reach insular communities, such as homebound seniors, the working poor, families, Russian-speaking communities, people experiencing homelessness and poverty, among other under-resourced communities that are a WeHo priority through these collaborations. As Sherry and Brian mentioned, we also improve the efficacy of existing social service programs. For example, if your substance use disorder program always has fresh donated meals, you are more likely to keep in touch with your case manager and visit regularly. We will ensure these new food programs predominantly serve WeHo stakeholders, and we track this data closely. We would like to ask the Human Services Commission to revise the funding recommendation of $0, even to a lesser amount, so that we can pilot this program within the city. And it's not really a pilot program, we've already done it before, but it would be a new initiative within the city of West Hollywood. And hopefully we can reach more people who are not accessing existing resources. So thank you for listening and for your consideration of this request.
Thank you.
Thank you, Asher. Okay, next up, I have Brother Henry Perez. If you are in the room, please feel free to take yourself off of mute. And if you are comfortable turning on your camera. You'll have 2 minutes.
Thank you, Council. I came back to Hollywood in the summer of 2020 during the middle of the pandemic, and was able to meet with some of the board of directors at the Hollywood Food Coalition. And they asked me to provide a space for some of the homeless people to come and sit and relax. That was the biggest point. But as they're relaxing in a place to sit and not be pushed along, they said, why don't we help you provide the food? And it was the Hollywood Food Coalition that came to me and asked me to provide space at Blessed Sacrament, you know, the big old church on Sunset in Hollywood. So I found a space to start a lunch program called Genevieve's Garden. We're open Monday through Friday. We currently service about 100 people a day, and it's about 85% of the food comes from the Hollywood Food Coalition. And let me tell you, if you were hungry and came by, we wouldn't turn you away, and you'd be surprised how beautiful the food is. It's usually food that's rescued from movie sets that we get, or from Netflix, if they have leftovers from an event that they had. The Hollywood Food Coalition collects it and then redistributes it. Somebody earlier today said that the grocery stores and restaurants already have programs in place. If they do, I don't know who they're giving the food to. And if I had to search for the food, I would need 3 or 4 other people, staff members, which, sorry, somebody is calling right now on my phone, and I can't find you guys. Give me 1 minute. There we go. It would take so much work for Genevieve's Garden to have a crew to try to collect the food. And the Hollywood Food Coalition is a great service for people that need to serve others, need to feed others, I should say. And that's all I have.
Thank you.
Thank you.
Thank you. Next, we have Clifford Roberts, and Clifford, you will be followed by Rob Lester.
Good evening, service staff, commissioners, and other invested parties and gatekeepers. I want to address 2 items. The first one is there was a bit of a glitch with our scope of practices. If you look at the RFP, I want to assure you that we're going to be providing the same comprehensive services. What we submitted was an augmentation of services that would be actually increasing assessments and street supportive services with a subcategory for BIPOC community members. I also want to really extend my appreciation for the social services staff recommending our program for hopefully a robust 3-year contract. We would like your consideration to revise and revisit and repurpose the funding for an outreach worker. We're happy that there are other members that can provide that support. And repurpose that funding for a clinician. Our current clinicians are at capacity, which indexes our success, providing street supported behavioral health and deep comprehensive mental health services among housing and other items. But as their caseloads have grown, we want to have a clinician that can absorb additional caseloads. We have a strategy in place where our existing clinicians can do so, but without stretching our services, we would feel it appropriate to have that additional clinician. If that is something that can be reconsidered, we're happy to provide some revisions on our end if that's necessary. Again, we're very delighted and very excited and enthusiastic to continue working with our other contracted agencies, city, and I appreciate the commissioners, again, consideration for our program. I am ready to stop before the bell. Good evening, everybody. Thanks so much. And again, my name is Clifford Roberts. Step up on second. Almost before the bell.
Almost made it.
Almost.
Thank you so much,
Thank
Clifford. Rob, if you are available, and Rob will be followed by Maria Roman.
Hi, good evening, everyone. I'm here with Brian Rogers, who's also one of our staff members and one of our clients. So if we could speak together, that'd be great, but I understand. In any case, I'd like to thank the City of West Hollywood and the Human Services Commission, and of course, all the hardworking staff members for your generous support over the past several funding cycles. You've really played an integral role in our ability to build up our PrEP and PEP navigation services, which has made such an amazing difference in the ability of people to avoid contracting HIV. We've built our program around a skilled and experienced PrEP navigators. Our navigators are trained on a wide range of support options so that patients can obtain PrEP and PEP medications at an affordable price or for free, or whatever their particular financial situation needs to be. We've trained them specifically for PrEP and PEP, so that allows us to keep them up to date on changes in medications such as injectables, the evolving patient assistance programs, which change quite frequently, the PrEP app program, which is from the state, and all of its various and sundry evolutions, as well as whatever regular insurance needs they have through, with their employers or through Cover California. We also have on staff benefits navigation specialists. We employ these because we've seen an alarming trend over the past 2 or 3 years, the past 3 years with COVID, where people have a tremendous need for a broad range of benefits navigation services. And our benefits navigators can link them to these services. And this includes things like assistance with health insurance, other than PrEP, housing assistance, transportation, food assistance. So our benefits navigators are really trained to be able to provide people with linkage to the entire spectrum of services they come to us with. And so, therefore, I respectfully request that you consider our full proposal for the benefits navigation services, along with our existing PrEP and PEP services. And I will turn it over to my colleague.
Thank you. And I'm sorry, Rob, who is your colleague again?
Brian Rogers.
Brian Rogers. Okay. Brian, if you are in the room, please feel free to take yourself off of mute, turn your camera on if you are comfortable, and you will have 2 minutes.
All right, thank you so much. And once again, I will echo Rob and thank you for what you have forwarded us in the past and for what the recommendation is currently this year. I think during this pandemic, and Men's Health Foundation has not only been able to survive, but we thrive, particularly in our PrEP and PEP services, with the introduction of our Rapid Results Clinic at 8280 Santa Monica Boulevard. We've really seen an increase of, in terms of our intake for STI testing, but also with our PrEP services, and specifically with our PEP services, a lot more patients are being served. And at this point, we're feeling that we're able to really substantially give that foundation of services, and we'd like to extend that even further. This additional funding would allow us to go beyond just those baseline PrEP and PEP services and dig into more outreach to promote our services more, but specifically and largely, we want to get into the benefits navigation space where we're able to make sure that everyone in the community is best aligned with the health insurance that is most appropriate for them, so they get the most impact and ultimately keep our communities healthy and HIV free. Thank you.
Thank you.
Thank you. And next, I have Maria.
And we did have a patient as well, if Ollie is around. Sorry.
Did I mute myself?
Yes. Ready for you. No, yes, no.
Oh, go? Okay.
Yes.
Hi, everybody. Maria Roman with the Trans Latina Coalition. Thank you so much for giving me the time to speak. I want to say that the Trans Latina Coalition really is appreciative of the relationship we have had for the last 3 years. It has really made a great impact of the trans and non-binary community that both lives, resides, and spent a significant amount of time in the city of West Hollywood. I also want us to look at, if we look at all the funding that is going to trans programming, that if we look at some of the recommendations of staff, which I know is going to be a really tough decision to decide who gets what money. But if we take a step back and look at the bigger picture, the funding that's going specifically to trans folks in some ways is decreasing, even though we are getting an increase on our budget. As one of the largest trans-led organizations, both in Los Angeles and servicing the city of West Hollywood. I hope that you consider fully funding our program. Our program has really provided critical services, like I mentioned in my opening statement, to the community. And I firsthand know the challenges that our community has faced navigating the existing plethora of services that are LGBT. It can be very challenging, and there's a lot of loopholes, even for us as an organization, to be able to secure access to our clients to those programs. We serve as a bridge to connect folks to the array of funding programs that you have here within the city, but even navigating those systems for us as a trans-led organization on behalf of our clients has had its own set of challenges. So we are proposing an amazing array of services that will begin to address all the social determinants of health that the community continues to face that leads to poor health outcomes. I have much more to say, but that is all my time. I hope that you will fully fund us, and thank you for everybody being here.
Thank you, Maria.
Thank you. Okay. And thank you everyone again for your patience. I just have two other names of those who signed up in advance for public comment, and then I will begin to call on you with your hands raised. Okay, Siri Perlman. Siri, if you are ready, and Siri, you will be followed by Moshe. I do apologize if I'm mispronouncing your name. Okay,
Thanks
Siri,
so much.
the timer will begin when you're ready.
Okay, thanks, Dee. Thank you so much to the commissioners and the social services staff for having us tonight, and also for your continued partnership. We also appreciate the fact that you take into consideration the vastly increasing costs of running a nutrition program for the seniors within West Hollywood. As we know, not only from this pandemic, but just inflation in general, we have extraordinary increases in costs for not only personnel, but also for a lot of our food, our transportation costs, and packaging. So first, I want to say thank you for that. And then on a really just happy, positive note, as we continue this relationship and services that we provide, we just opened Plummer Park for dining in. The meal site just opened so the seniors can come and dine in person, and that has not happened for 2.5 years. So Plummer Park is now open Monday through Friday for in-person dining for our seniors that are 55 and over. And I just also want to say how much we appreciate the continued partnership and creativity and flexibility and problem solving that has been required during this pandemic with our partners within social services, so that we could continue these uninterrupted meal services through the pandemic. So it's an acknowledgement that you're acknowledging the increased needs that we have to continue these services, but also just for your continued partnership through this time. And a quick fun note, I do see the timer. Just a little bit about the clients that have been coming to see us. I found out recently we had a meal site romance where there's a couple that met in our Plummer Park meal site that has been coming back to see us. We also have some returning folks as well as some new people that are benefiting from the program. And just, one of the clients saying how much these services, beyond just meals, but the services that we provide in West Hollywood, how much it helps him and how grateful he is. So thank you.
Thank you.
Thank you, Siri. Okay, Moshe, I do apologize. If you are still in, if you can take yourself off of mute, turn your camera on if you're comfortable, and you will have 2 minutes.
Yes, hi, my name is Moshe. I just wanted to, I never used social services until last 2 years. I just wanted to appreciate the social services that I got to in LA, and especially here in West Hollywood. I'm a resident of West Hollywood for the last 11 years. I've been helped with the CES, a guy named Eugene. He helped me a lot with the rent assist, with the Jewish Family Services. Nina, Suzanne, and Rachel were just wonderful. Just helped me through all the questions that I had and needed. I got a eviction note. So they helped me to reach to Bet Sedek, and Rachel Levy just helped me with that issue, because I've got nothing, no education at all when it comes to a law and letters and all this. And the last one that I wanted to thank is Andy from JBS with the workforce in West Hollywood Library. I just wanted to thank every one of them, and I wanted to thank to all of you. I never knew that West Hollywood has so many social services, and I really appreciate it, and I thank you all, and it comes from the bottom of my heart. And I wish you all the best, and keep on the good work. I really appreciate it. Thank you so much.
Thank you.
Thank you.
Thank you. Okay, the first hand raised, Yola. Yola, please feel free to unmute yourself at this time, and you can turn your camera on if you are comfortable. You will have 2 minutes.
Thank you very much. Good evening, Chair. Good evening, staff. Good evening, commissioners and honored guests. Yola Dore, West Hollywood. First of all, I'd like to take a moment to thank each and every one of you for your gracious, services you provide to the residents of this city. We certainly appreciate it. But tonight I would like to do a special lobby to each and every one of you for the JFS Comprehensive Service Center, whose services have been incomparable. I would like to lobby for the services of Step Up on Second, who I've seen in action on the street, helping unhoused members with a multiplicity of problems. I'd like to lobby especially for the LGBT Center, who is doing marvelous things for the seniors in our city. And I would like to lobby for an agency I've yet to use, but am very hopeful to use them in the near future, and that's DCRC. Many of the agencies have been award recipients. And again, we're very much gracious and thankful for their services to all of us. Thank you, commissioners, for helping in the process and your dedication.
Thank you.
Thank you, Yola. Okay, Maria, I see that your hand is up. You have 2 speakers for Trans Latina Coalition.
Yes.
Okay.
One of them, you want to talk? She's going to speak in Spanish.
Okay, so let me. I don't know why I just drew a blank. My apologies, Frank. If I can, please grab your attention.
Yes.
Thank you.
I'll just instruct her to pause after 1 or 2 sentences so I have time to interpret. Señora, por favor, con su mensaje, limítelo a 1 o 2 frases para que tenga tiempo de interpretarlo.
Ok, muy buenas tardes, mi nombre es Lina del Río.
Good afternoon, my name is Lina del Rio.
Yo vivo en la ciudad de West Hollywood por 42 años.
I've lived here in West Hollywood for 42 years.
La razón por la que estoy aquí es en mi apoyo a Trans Latina Coalición.
And I'm here to show my support for the Coalition for Trans Latina Support.
En especialmente al True Program.
And especially for the True Program.
En todos los años que llevo en West Hollywood.
In all the years I've lived in West Hollywood.
Cuando nadie me dio una ayuda, yo soy una persona VIH por 42 años.
when nobody was giving me any help or support, and I've lived with HIV for 42 years.
Yo oí de la Trans Latina Coalition, me acerqué a ellos.
I contacted the Trans-Latina Coalition after I heard about them.
Y me han ayudado en muchas de las necesidades que tengo como persona mayor y como persona deshabilitada.
And they've helped me with a lot of my needs as a person with special needs and somewhat aged as well.
Y lo que les pido es, por favor, que los sigan apoyando a ellos, a su programa de True, que han dado mucho por nosotros.
And what I urge you is to keep up the support for this organization, True, so it can help others.
Que han hecho una diferencia para mí y para mis compañeras, han hecho una diferencia y nos hacen sentir como que valemos y somos alguien.
They've provided a lot of support for me and others I know, and it's really a worthwhile effort.
Es todo, muchas gracias y por favor, ellos merecen todo el apoyo que ustedes le puedan dar.
That's all I have to say, but please, they deserve all the support that you can provide for them.
Thank you, gracias a todos.
Thank you to everybody.
Thank you.
Si quieres acercar un poquito más para acá. ¿Sí?
Aquí sí.
Ajá.
Oh, buenas tardes, mi nombre es Elsa Johnson y soy una mujer transgénero de 62 años.
Good afternoon. My name is Elsa Johnson, and I'm a transgender woman that's 62 years of age.
Yo agradezco a Translatina Collection y a su programa The True de la ciudad de West Hollywood por el apoyo incondicional que me ha dado.
I am very thankful for the Trans-Latina Coalition and the True program and the support that they provided for me in West Hollywood.
Yo he sido residente de West Hollywood por 35 años.
I've lived in West Hollywood for 35 years.
La pandemia del COVID-19 me afectó gradualmente.
The pandemic of COVID-19 has affected me
gradualmente en mi estatus emocional y de vivienda.
Gradually, both in my emotional state as well as my living situation.
Yo traté de pedir ayuda y fui personalmente al GBC y me dijeron, no podemos ayudarte. Fui al LGBT Center, tampoco me pudieron ayudar. Fui a West Hollywood City Hall, al Rent Control, porque yo estaba perdiendo mi departamento, y Adriana, que trabaja para el Rent Control, me dijo, aquí nosotros no te podemos ayudar, no hay ayuda para ustedes.
Disculpe. I went personally to GVC and they didn't provide any help for me. There were a couple of other associations, LGB, I think, and Center, and then also the West Hollywood City Hall, and I was told there's no help available for me there.
Desafortunadamente, sé que los requisitos son limitados para True, pero yo pido, por favor, que existimos, somos personas, y si pudieran proveer.
Unfortunately, the funds and the support that True can provide is limited, but we exist and we need the support.
Proveer con vivienda y ayudas y más programas para las transexuales de la tercera generación.
We need more help with housing and other programs for the transgender population of the third generation.
Yo por eso les pido con fe y pongo mi fe en el programa True, que nos va a oír y nos va a apoyar.
And that's why I rely on my faith to ask for you to support the program True for all of us.
Y agradezco a Translatina Coalition por toda ese apoyo y esa ayuda que siempre está ahí para nosotros.
And I'm very thankful for the Trans-Latina Coalition and the support that they've always provided.
Por favor, pido, si es posible, que el programa True pueda apoyar más a Translatina para más apoyo.
So if it's at all possible, I urge you to provide more support for True so it can help more transgender people.
Gracias por apoyar a la comunidad de la tercera edad, Translatina Coalition. Gracias por el programa de True y yo aprecio mucho. Gracias.
I'm very thankful for your support for the transgender in the third part of their life and the support that you can provide for True and the Trans-Latina Coalition.
Thank you.
I would like to,
Thank you.
is there any possibility that I can have 2 minutes too?
Lisa, right?
Yes.
Okay, perfect. I'm sorry, the
no,
distance, so I can't
Hello,
see.
everybody.
Absolutely.
Hi, hello everybody. I'm one of the case managers here at Latina Coalition for the True program, which is part of West Hollywood. And as working in this amazing program and seeing the difference that has made in my community, I urge you to reconsider the amount of money that you guys are giving us, just because I see the specific needs that my community needs and that continues to need. And I would really, really like to help all my community. You know, the resources, unfortunately, are not enough, especially with this times that rent's going higher, you know, that bills are getting higher, that food, the cost of food is going higher, you know? And I would really, really would like to make a difference in my community. So if you can please give me that opportunity by giving us what we're asking for, it will really improve the life, not only of all the people that I'm serving right now, but of the future trans and non-binary people that will be part of the True program.
Thank you.
Thank you.
Okay, next up, I have Tim Alderson from Seeds of Hope. Tim, you will have 2 minutes.
Go.
When you start, I start.
Okay, good. I didn't know if I lost 5 seconds there while I was collecting. Okay, here we go. Thank you. Thanks to commissioners and staff for this opportunity to talk to you tonight, but also, and more importantly, for the last 2.5+ years that we've worked together. It's been a real privilege and an amazing time to be able to do some significant amount of work. And we are most appreciative of our dear program monitor, Joan Mithers, who is just absolutely fabulous, and we couldn't have done it without her. As Joan mentioned in the summary of what we've proposed and what we're currently doing, we currently have a contract to provide nutrition education, healthy cooking classes, free fresh produce, therapeutic gardening at 8 different West Hollywood Community Housing Corporation housing sites, where we work with close to 500 people. Over the course of this last couple of very weird years for all of us, when everything turned upside down and the scope of work was challenged and so on, we've been able to come at that very creatively. And over the last year, we've also added weekly produce distributions to the entire community at Plummer Park. So what we've proposed was to expand the number of housing sites and to add the Plummer Park distributions into a new proposed contract. What staff's recommending is an amount of funding that's about 56%, actually not about, it's almost precisely 56% of what was requested, which clearly implies that we won't be able to do all of the proposed services. Everything that we do for the city leverages other funding sources. So actually what our current funding for this contract and what we propose for the next contract don't actually reflect the total cost of the project. We do the best we can to pull money together, but we're going to have to work very creatively with staff to figure out how to pay for all this stuff. So that's it. Thank you.
Thank you so much. Okay, Andy, you are up and the time will begin once you are ready.
Chair, Vice Chair, Commissioners, and staff, thank you for the opportunity to speak. I'm Andy Socker, the Program Manager for JVS Socal's Weho Works program. We are very grateful to be recommended for a new 3-year contract. It is also encouraging that job training and placement services was identified as a priority through the community engagement process. We ask that you reconsider the preliminary recommendations so that we have funds to hire a second half-time career coach. Our proposed increase will adjust funding for a January 2021 staffing change, continue high-quality job seeker and employment services or employer services, and increase essential BIPOC worker recruitment efforts. Although our pivot to working remotely and by appointment throughout the pandemic has been successful, the public demand for use of the facility will increase as we move beyond COVID restrictions. It will be critical to have a career coach available on site all day to increase enrollments and return to daily operations. Reaching BIPOC workers requires more footwork and a variety of in-person outreach that cannot be completed from the Career Center itself. By granting our original funding request, we will continue to support a high level of customer service and help us increase percentages of our BIPOC clients. It's also important to note that our program monitor, Leslie, supports the idea of having two full-time employees, but we believe that this goal is better served by 2 half-time career coaches to maintain service when our small team experiences disruptive employee turnover. Thank you.
Thank you. Myra Friedman, please feel free to take yourself off of mute and turn your camera on if you are comfortable, and you will have 2 minutes.
Good evening, Chair Palmieri and commissioners and staff. You're wonderful. I'm here to support. I'm a little firmish. DCRC. They've helped me so much, and I'm a 78-year-old disabled woman and trying to live and age in place as graciously as I can. And they have made that possible. I can do things now that I wasn't able to do before for 42 years in this apartment. And I was kind of hoping that they would get a little bit of a raise in their allotment, but I'm glad to see that you are supporting them again. I also want to support JFS, which I know is a longtime partner of yours, but without them helping me to get SNAP EBT, I would be food insecure. They also have 2 lovely gentlemen who do a wellness check on me twice a week. And I get a social worker every once in a while coming in to see my dirty apartment and trying to persuade to have help in my house, which is hard for me because I have a big dog and I had an unfortunate experience with Golden Choice. So I'm a little resistant, but they've all been so wonderful to me and made my life much easier. I think that they also hire wonderful people. The contractor, Home Health Depot, fabulous. Joanne Branken, the therapist they sent me, the occupational therapist, top drawer, and they deserve all the help that they can get from you because they are great. JFS and DCRC are wonderful. I would like to do my part by getting more people in the city of West Hollywood to be aware of them, and I'm trying very hard to do that right now because people are not as aware of these wonderful agencies that you partner with as they should be. Thank you. Bye-bye.
Thank you. Okay, next, Rachel.
Hello, everyone. It's good to be with you all again this evening, staff and commissioners, our fellow grantees in the West Hollywood community. I would say that the past 3 years have looked quite different than when we received our last round of funding in October 2019. We had 6 months of our program before the COVID shutdown happened in Los Angeles and in the country. We really learned immediately just how many community members are on the verge of economic devastation, how just 1 or 2 missed weeks of work means someone cannot pay rent the next month. And these interactions, even from 2 years ago, really helped to inform and guide our vision, our new vision for rental assistance moving forward. We are so grateful for staff support for Leslie and David, especially for Leslie for the past 2.5 years, and just for the Commission's continued support of our work. We appreciate everyone's just belief in our new vision for expanded and extended rental assistance support and what this will mean to community members to be able to stay in the city of West Hollywood, to be able to live where they work and continue to contribute to the vibrant community that they love living in and being a part of. We're really hopeful that commissioners, that you will all support our vision for this new version of rental assistance as well. We are grateful for this collaboration and we really look forward to moving forward together. Thanks so much.
Thank you.
Thank you. Lexi, if you are ready.
Yeah, thanks so much. Good evening, Commission. My name is Lexi Adsit. I'm the Executive Director of Trans Can Work. I'm proud to say that regardless of funding, we won't be going anywhere. But choosing not to fund Trans Can Work is a missed opportunity to represent the values of West Hollywood. Trans Can Work is one of the only trans-led and POC-led agencies within the actual boundaries of West Hollywood, and we know that trans people are continually under attack nationally and will continue to flock to the coast looking for resources and services. Safe and equitable jobs are lifelines that prevent homelessness, substance abuse, and crime, and funding Trans Can Work means prevention of these social issues. We have evolved a lot this past year, and I know that previous executive leadership has been an issue, and I'm proud to say that that's something that we fixed this year. And we are going to continue to be a national leader in workforce development and the movement for trans equality. So please consider fixing this mistake and reconsider funding Trans Can Work and let our community know you stand with us. Thank you so much for your time.
Thank you.
Thank you, Lexi. Ashley, you are up.
Hi. Oh, I don't know if I think my video is broken.
Yeah.
Oh, here we go.
Oh, there it goes.
Hi. Sorry about that. Hi, so my name is Ashley. I am the Deputy Director of Friends Research Institute. And I wanted to start off by saying I really appreciate the Commission's ability to recognize that cost of living in LA and West Hollywood has gotten astronomically expensive. So when the RFP did come out, it definitely warmed my heart a little bit to see that that was recognized. And I just want to say I appreciate that. And additionally, I know we had a little bit of a Hail Mary to pull case management services out, but I do appreciate staff recommendations and say that we're going to keep doing what we do and we're going to do the outreach. Case management has gotten a little bit more intense since 2019 when the cycle happened last, but as we all know what happened. But I do just want to say that, thank you again. We're going to keep going. And I really do appreciate the opportunity to be given the time to speak here today.
Thank you.
Thank you, Ashley. Okay, Iris, you are up.
Hi, good evening, and thank you, West Hollywood Commissioners, staff, and residents for this opportunity to speak in support of Trans Can Work. While we have struggled with some of our grant deliverables, we have worked together as a team to pivot when needed and develop new strategies to lead TCW, meeting many of our deliverables and exceeding in other grant deliverables. We are starting to see the fruits of our labor by building strong partnerships with other organizations eager and willing to hire as well as support TGI people in the workforce, including Grindr, Glassdoor, Warner Media, and Socal Edison. It would be heart-wrenching to see our organization face another serious setback when we are finally in a place to truly succeed. TCW not only connects TGI people with employment opportunities, but we also create jobs. Several years ago, I had to exit a small business that I co-founded and built from the ground up. 6 months after opening our doors, I became disabled due to chronic illness. I had no one to advocate for me, and I thought I was out of the workforce for good. I enrolled with Trans Can Work as a job seeker. I attended career fairs put on by Trans Can Work and applied for hundreds of jobs. It felt impossible to find a position that was compatible with my illness and my needs. When I was running out of options and I was at risk for losing my housing, I saw a job opportunity for TCW. I applied for a temporary part-time position that was work from home and thankfully landed the job. Within several months, I was able to turn it into a full-time position. At TCW, I found employment, camaraderie, and hope for the first time in a long time. With the support and access to healthcare through TCW, I was finally able to begin my medical transition this past winter. I am finally in a position where I can continue supporting my community again instead of needing help myself. TCW is not just workforce development. We are building networks to support the TGI community when so many other systems are against us. We are creating jobs and we are working. Commissioners, I plead that you reconsider. Thank you very much for your time.
Thank you.
Thank you. Jamie, to the stage.
Good evening, everybody. Good evening, commissioners and staff. Thank you for your ongoing support to the cause of ending HIV. We're so proud to work with West Hollywood, a city that provides extraordinary support for its citizens and constituents. The increase quoted is greatly appreciated, especially as we are moving out of the COVID pandemic and returning to grow our services. As a smaller organization, any additional consideration for increases to fund our full request would make a tremendous difference to us and the people that we serve. As a smaller agency, we have slightly less robust funding streams as some of our larger partners, so a little bit goes a long ways with us. I appreciate your time, and I'm not sure what I'm going to do with my Tuesday evenings in the near future without seeing you all. So thank you so much for your time today.
Thank you.
Thank you. Bambi?
Can you hear me?
Yes.
Greetings, beautiful people. I hope that you're having a beautiful day. My name is Bambi Salcedo, and I do have the privilege to be the president and the CEO of the Trans Latina Coalition. And I want to first thank the staff from the Social Services Department for the hard work that they have to do, and certainly all the commissioners to also do the hard work that they need to do. I do want to just echo what Maria Roman has said, and I want to obviously extend the importance of investing in the lives of trans people, but even most importantly, investing in trans-led organizations. Our organization has a proven track record of delivering the services that we have. Last year, we had over 5,000 people who walk to our doors. We have provided a multiplicity of services that are specifically dedicated and designed to support members of our community. And the proposed program that we proposed this year for funding is a comprehensive program that we believe is also going to support specifically members of our community from the city of West Hollywood. It's important that, you know, as the only trans-led organization that is in this docket of funding, we want to request that this commission fully recommends the funding that we requested. We don't want to be shortchanging our community through the services that they need. And so, although I understand that it is hard to allocate funds for everyone, we need to look at what equity looks like, right? And again, as the only trans-led organization, we ask that you consider for us to be funded fully. Thank you.
Thank you.
Thank you. Marina Berkman?
My video is stopped, so, but I will start talking like that, if that's okay.
That's okay.
I didn't
We
know
can
the
hear
video
you.
doesn't work for some reason. Good evening, commissioners. Good evening, staff. My name is Marina Berkman. I'm the director of West Hollywood Comprehensive Service Center Program of Jewish Family Service. I would like to thank you for the support that you are giving to the older adults and younger disabled adults in the city of West Hollywood. We are very proud and privileged to work in collaboration with the city for the last 37 years. JFS was contracted to provide the services to older adults just 1 year into the cityhood. But the last 2+ years have been the most challenging in our service history. And I have to say that we were able to adjust to a new way of providing services and to meet the needs of our community members. What we were not able to adjust is the inflation. I'm sure that we are not an exception in this audience. And we appreciate very much the recommendation to add funding for the in-home care services. The hourly rates for home care increased dramatically in the last 3 years. And with this additional funding, we will be able to offer almost the same number of home care hours as before. But please consider a larger increase given inflation and our employment cost. The recommended increase is about 2.5% over last year's funding. Our staff is in the union, and we're currently in negotiations for a new 3-year contract. We will be providing increases much higher than 2.5%, and it would be wonderful for the city to support our employees with the higher increase in funding for the Comprehensive Service Center. Thank you so much for considering that.
Thank you.
Thank you. Ali?
Good evening, everyone. My name is Ali. I've been the resident of the West Hollywood for the past 11 years. And I started with Men's Health Foundation in 2016 through my friend Efren, who introduced me to the PrEP program. I moved here from Iran. I didn't have enough knowledge about HIV prevention. And I was very happy to get informed and seeing providers that I could easily talk about my sex life and get help from them. One of my recent experiences with rapid result was that I had this emergency and I could see a doctor, do my test and get my medication in less than 30 minutes, which in today's life speed, which is an amazing timing. And I would like to acknowledge that to the providers and thank them for that.
Thank you,
Thank
Ali.
you.
You're welcome.
Okay, Jovan.
Awesome. Hello, everybody. Thank you for allowing me to speak here at this meeting. Jovan Wolf, he and they pronouns. I'm the Director of Workforce Development here at Trans Can Work, and just really here to advocate for our team. But firstly, I want to just say I'm so proud of Trans Can Work and the team that's here and not here. We are a small but mighty team, and we are making such great impact in the world, really. You know, what we do is so unique. You know, we have come across a lot of adversity, yes, throughout our contract with the city of Weho, and I'm not going to say we haven't. You know, we lost our founder, we lost our ED, we lost our main trainer, we lost our Weho navigator, but still we prevailed. We got a new ED, we got our navigator, we got a new manager, we now have a team of 10, you know? And yes, we have taken time to meet some of our deliverables, but if you can just take a look and just look inside deep, like, who is Trans Can Work? What do we do? Where have we been and where are we now? What are we doing now? Right now, we are over exceeding our deliverables and we are on track to hit every single one of them and more. You know, what we do, like I said, it's not just here's a job for the trans community. No, it's how can we make impactful relationships with employers so that we can be transparent to say, hey, this employer has done training with us. They want to support you. Now we have a recruitment department that we just started in February. We're getting those jobs. We're getting them to our job seekers. You know, we're having these meaningful relationships, as Iris said, with Glassdoor. They've come in, they've done our DEI training. They are offering workshops now and mentorship support for our job seekers. Grindr, they reached out to us. They got their DEI training done with us. Now they had their internship programs and they wanted to hire from our job seekers. They already hired one person. We got 5 people going through this. So I'm just saying, please reconsider because we're a small and mighty team.
Thank you.
Thank you, Jovan. Ange Cruz?
Yes. Hi, everyone. Thank you for giving me a chance to speak. My name is Ange Cruz, and I am the social media coordinator for Trans Can Work. I've been working with TCW since October. Prior to me, there was no social media coordinator or really anyone who was focused on communications at TCW. We have seen the ways social media has impacted communities and the ways we can provide resources. And in the short time I've been working at TCW, we've managed to achieve so much success, surpassing industry standards in terms of follower analytics and numbers, and developing stronger bonds with other organizations in the Los Angeles and West Hollywood community. I say all of this because this is the success that we've been able to achieve in less than a year. And like Jovan mentioned, with a social media team of just myself and my colleagues who support me, along with completing their other responsibilities. We acknowledge our past, but we also know that we are capable of so much success in the future. I also want to bring up, I am someone who is young. I'm in my early 20s. I have just graduated college. I identify as queer. I am TGI. COVID has made entering the job market terrifying. I know for myself and many people my age and in my position, we can only have dreamt of having an organization like TCW ready and eager to support us in the way our organization does. So I hope you consider this while making your decision, and I appreciate and thank you for listening.
Thank you.
Thank you so much. And Chair, there was one other hand, but this person, they keep experiencing connection issues and I don't see them in the room anymore.
I am also, my internet is going wonky right now.
But that was the last public comment that we had as far as hands raised.
Great.
Oh, I just got a message that they will be attempting to come back in. If it's okay, if we could just wait a few seconds. Thank you so much. All public commenters for your patience. We got through it, you all. So thank you all so much while trying to juggle all these different screens. I appreciate your patience and understanding with me. Okay. I don't see, okay, Carol. This is not who, but Carol, we welcome you in this moment. Please unmute yourself. Turn your, I'm so sorry. I'm just trying to pass the time. Carol, please feel free to unmute yourself and you will have 2 minutes.
Hello?
Yes.
Can you hear me? I couldn't figure out how to get on. My name is Carol Olegario, and I'm with West Hollywood, and I'm a recipient of the wonderful fresh vegetables and fruits that Seeds of a Hope has provided for seniors. And they're like unsung hero. You have no idea how diligent they are, how incredible they are, and how they make every effort to give to supply these needed vegetables, especially during the COVID. And when someone was not able to get to Plummer Park, they've actually delivered. And I just want to say that they really, everything they do is first rate. And I really want you to reconsider. And I think they need more, the funding that they've asked for, because they are invaluable. Thank you.
Thank you. Is the other public speaker in the room yet, Dee?
No, but if they come by the time we get to item 7, if it would be okay, I will call on them.
Okay. All right. Well, I mean, at this time, I'm imagining that we will. Is David in the room?
I am.
Yes.
Oh, okay. So we will close this and then we will come back to you.
Yes.
All right. So I'd like to close the public hearing. Thank all of the speakers, of course, and go hand this back over to David Juni.
Thank you, Chair Palmieri. First, I also want to thank all of the folks who came this evening to speak on the recommendations. It is very good to hear from all of you. It's a tough, we make tough decisions, and we appreciate we appreciate how much you care for and want to serve the West Hollywood community. I also want to thank all of my staff who did such a great job with their presentations and explaining our recommendations. So tonight you did receive the social services staff's contract recommendations, and you received the input from the community. We will return next Tuesday, and that will be the final meeting, should be the final meeting of the month. And at that time, you will consider staff's recommendations. So we'll go through them with you, and we will look for your approval. Certainly, if there's discussion to be, had, we welcome that. If there are revisions, the commission as a body wants to make revisions, we will discuss those at that time and see if we can come to agreement. We like to be able to take a one set of recommendations to council that we've agreed upon, but certainly that's what this process is for, is to have that discussion. So that's what's on tap for next Tuesday, to review and recommend to City Council the contracts that staff's recommended, and or with any revisions from the commission. In addition to that, the second recommendation is to approve staff's recommendation for an additional $522,476 in unallocated general fund reserves in order to enter into the contract with Healthcare in Action. So those will be the two recommendations that we'll go over next week. And if there's any questions, clarification needed from staff at this time, we welcome that from the commission.
Okay, I can't see the hands if there are any. There's only a few commissioners that I can see. So if any commissioner has a question of or clarification of staff, that would be this would be the time this evening to ask. Anything, Dee? Can you see?
I'm not seeing. Oh, Commissioner Davis.
I just had a really quick question, and I figured it was going to wait until next week, but I can ask it now. I wanted to know why Healthcare in Action, why there's a $37,000, or excuse me, I get it right, $33,000 allocation in one spot, and then you have asked us to consider and approve like a $500 and some odd thousand spot that they would obviously be going to the same organization, and it would be combined. So I'm not certain why you didn't ask for the total amount and allow the $37,000 to go somewhere else.
So we did carefully consider the recommendations. First, as I mentioned, we looked at the $6,300,000 and what 87,000. We looked at that, and we came up with the recommendations that you received tonight. It left that relatively small amount of remaining funds. We knew that we wanted to make the recommendation for Healthcare in Action, and so to be prudent, caretakers of the city funds. We put the remaining general funds towards healthcare in action, and then the difference is what we have recommended to request from council from unallocated reserves.
Okay. So it could be zero. The one that's the 37 or 33,717 could have been zero. It's just the money that you had no other, like at that time, to allocate in a specific place. So I'm trying to understand again why we just don't go for the entire amount that needs to be. I mean, you're already going to ask us to ask council to approve something that we don't actually have the money in our hands. And so I don't understand why we just don't ask for the entire amount and take that $37,000 and move it to something that we could possibly use in a different, for a different organization. So would there be a problem with that? Because that's where my mind is gone. So if there's a problem where there's a hindrance that I'm not seeing, I would prefer to hear it now than just sit on it all week and then come back on next Tuesday and say the same thing.
So there's not a hindrance. We made the recommendations based on the approved budget. And in addition, we realized throughout the process, we had slightly more money in the approved budget than we first understood. We thought we had an even $6,300,000, but we had $6,378,852.
Mm-hmm.
And when we realized that, because we were going to also recommend unallocated reserves for part of the Maple Counseling Center contract, but when we realized we had additional funds, we put all of Maple Counseling Center under the general funds. That left that, the 37,818, is that, no, 33,717. We put that towards healthcare in action, and then the remainder is the request for unallocated reserves.
Okay. I'm not certain I understand it, but I do understand why you did it. It's just that if that amount of money is left over for the regular, and we're going to ask for a specific amount from council, there's no reason not to ask for the entire amount that we would like to have, and that 33,000 excuse me, could be used for some other area that we have dinged, or we could actually add to. So that's going to be where I'm going next Tuesday. Is going to be that $33,000 bothers me. It just sticks out, and it needs a place to go, and I don't think it needs to go. If it needs to go to that particular organization, then it needs to go as a total for council, and so they understand exactly what it is that they're funding.
So, and to that point, social services staff is confident in the recommendations we made, that with those recommendations, we are covering the issues and the priorities that were highlighted throughout this process and in the RFP. So with that, as I said, we do know that the number one priority that wasn't covered through this was additional crisis response to issues presented by our unhoused community members. So we were confident that we were able to cover the other issues with the approved funding. We had that 33,717 left over. We put that towards the healthcare in action, and then the remainder, the request and unallocated reserves.
I don't want you to think that I'm saying that staff doesn't know what the heck they're doing, or that you haven't done this and gone through all the numbers. It just sort of sticks out and makes me wonder. And so that's, I understand basically what you're saying, but I also understand what I'm saying. And so I'm probably not going to agree with you in a week over that $33,000. So the commission may which is fine. I'm used to being 6-1 anyway. So, but I do want you to know that I'm thinking about that, and that's all. I'm sorry I've taken up too much time. I can bring this up again next week. Thank you very much, Jimmy.
Thank you.
Thank
Are there
you.
any other commissioners that need clarification on anything?
Commissioner Borelli, I see your
Hi.
hand.
Thank you. I not to belabor this particular topic, but healthcare in action. I do think, David, you said either in your report or somewhere along the lines that your recommendation is roughly 50% of the cost. Is that correct?
Correct.
Okay. Thank you. I think a little differently, Commissioner Davis, just so you know, I have concerns about the pilot program getting this amount of money, but that's what we're here for, and we'll talk about it again next week. I do want to say that I just do want to talk about the amount from the city in terms of the 6.3, 78, blah, 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 blah. Looking back at 2016 and 2019, that is, might not seem like a significant increase, but it is a significant increase, especially with the additional funding that will go to council for, that will bring that up quite a bit. I'll say from a personal perspective, I have a family member recently diagnosed with a catastrophic illness. It's slow, it's debilitating, and their elderly, older adult mother is now their caretaker. And the city they live in offers zero support for them. And it's going to put a lot of stress and strain on this family. So I want to applaud the city of West Hollywood, the council previous, the council now, for this funding. I also want to say, well done, staff. This is hard. This is hard. There are times as I was going through this, I thought, yes, okay, good. Yes, okay, good. 2% COLA. The reality is it's not enough, but we get it, and that's and we're doing the best we can, as David says frequently, constantly. We're trying to make sure we spread it as much as we can to as many different areas we can. So I think, although I do have some questions to ask, and some of them were clarified tonight, so I have less questions. There are definitely some things that I agree with, sticking with your funding in some areas. Frustrating, but understanding. So I appreciate staff's really strong diligence in getting us to this point, and look forward to some discussions on it next week. That's all.
Thank you, Sam. Any other commissioners that I'm not seeing needing clarification?
Commissioner Freiberg.
Hello. I just have a few questions on clarification. So for the Disability Community Resource Center, what does staff believe wasn't necessary that you didn't give them all the funding that they asked for?
So the request was for the same level of service, but additional funding. The service is in the categories of home secure, case management, and information and referral. The next step of the process would be to clarify the scopes of service, but information and referral has been a category that the agency has not been able to reach consistently over this year and in previous years. And so we would really be looking at focusing their efforts on the two areas in which they have been extremely successful, which is the home secure and case management services.
Okay, yeah, I was just concerned about that. And I know that they want to open offices in West Hollywood, so I'm sure they're going to be back around again, probably with more services. The other one I wanted to ask about is Seeds of Hope. It says that they're increasing their sites from 8 to 13 and 50% more housing sites, but yet their staff recommendations were cut, even though food is a priority for the city. So how does that work? If they're upping their game, why would we cut that?
Staff recommendations were not cut. The current funding is $62,000.
Right.
So the staff recommendation was for $75,000 some.
But it says amount requested was $134,563.
Correct.
So then it was cut. What am I
Well, the
missing?
staff recommendation is for less funding than was requested, which is the case with a number of programs. One of the things that staff looks at are the costs in the budget. There were some especially high costs in that particular budget for employee benefits, but essentially staff is looking at what is the increase in service. So the increase in there was an increase in service, particularly in the number of sites, and then the funding increase that staff recommended brought it from 62 to 75,000.
Okay, that still doesn't make much sense to me, but I'll move on to the next one. So the Hollywood Food Coalition, it says that, once again, food is a priority for the city. It says that we plan to continue a relationship with them. This is what they do. They told you exactly what they did. So what would they have to change to become a partner?
So with this, there are other providers of this service. We've had some conversations with other departments within the city, with environmental services. They're not the only provider. They've mentioned tonight and previously that they are working with 125 nonprofit organizations currently. They made this proposal to focus or target on West Hollywood. The conversations that would happen in the future are to see how we can collaborate with them to let our organizations know that they are available. But we did not find a reason to specifically put city dollars for a service that's available.
Okay, thank you.
Thank you. Are we through the commissioners? I don't have all of you on my screen, so I'm depending on Dee for this.
Yes, Chair. It looks like that is it for commissioner questions or comments.
Great. So we can move on.
Yes.
So on number 4, new business, there is no new business. 5, excluded consent, nothing has been. Number 6, items from staff. David, do you want to start?
I didn't have any additional items. Is staff Leslie, Derek, Katie, or Joan?
Anybody?
I think we're good. Thank you.
Okay. The next item is number 8, items from commissioners. Do any commissioners have anything that they need to share or want to share? So I saw Vice Chair Meltzer's hand up first, so.
I just want to say
I'm sorry,
thank
Chair.
you.
I'm so sorry.
That's okay.
Chair, we missed the item 7 public comment.
I'm so sorry.
That's okay.
You're right. Barbara, you'll have to wait.
Got it.
My apologies, Vice Chair.
Is there any more public comment?
If there's anyone who would like to just speak for general public comment at this time, please feel free to raise your hand.
I promise I did not do that on purpose.
No, I know you didn't. That is why. No, we are okay. So you were right. Item 8.
But back to Vice Chair Meltzer.
Of course he did it on purpose. Just very briefly, I just want to say thank you to staff. It was, I mean, you've done so much work, and bravo to Dee. I applaud you.
Anybody else? Borelli, we get a timer.
Barbara, he set you up and then swatted you down. I would second the bravo to Dee and our chair for running a smooth meeting in a challenging time. And I do want to give a shout out, a very happy birthday shout out to a older adult stateswoman, Nadia Sutton, whose birthday is today. Nadia served on many commissions and advisory boards in the city and has been a leader and a mentor for so many of us. So happy, I won't say the number because I'll get in big trouble. Happy birthday, Nadia.
Anyone else? Okay, I just want to thank staff. I want to thank all the speakers. I want to thank all of the commissioners. This meeting went a lot more smoothly than it could have. And next, we will have adjournment until, David, what is the next week's date?
Tuesday, July 26th, 6 p.m. It will be virtual once again.
Tuesday, July 26th, 6 p.m. virtual. And I will see you all then, huh? We are
Thank
closed
you.
at 8:11 p.m., 7/19/20.